Welcome. You're watching The Moody Lawyer. Justice served with experience and integrity.
Hello and welcome back to The Moody Lawyer with attorney Josh Moody. With a rich background in law enforcement and a comprehensive legal career spanning criminal justice, personal injury, and civil matters, Josh offers a unique perspective on navigating the complexities of the legal system. My name is Kevin Rosenquist. Today we're talking about medical treatment after a crash and why follow-ups really matter for your case. Josh, welcome back.
Hey, thanks for having me.
So when someone is in a car accident, how soon should they get checked out by a doctor if they think they're okay?
Well, I think it goes. Each case is different. It's tailored to the individual. But like we've talked about in the past about medical treatment, you have to listen to your body. Obviously, if the injuries are major and there's blood everywhere, obviously the ambulance is going to take you, and they should. Obviously, listen to the medical staff on scene. If the ambulance is telling you they think you should go, you should go. If they're telling you not, then maybe not. But you also have to listen to your own body too. If you have those injuries and you feel like, oh no, there's something not right, you should go by ambulance immediately. Now, we've talked about too, if sometimes there's an adrenaline dump, and takes a few hours or a few days to feel the pain and any pain you might feel. Now that's when you should go. So that's what I talk about, or that's what I mean when I talk about listening to your body. If you feel fine and you don't want to go and make injuries up. But if those injuries do start to come in a few hours, a few days later, that's when you should get checked out immediately. But the most important thing is listening to the medical staff on scene. I can't tell you how many times I've seen in ambulance notes or medical notes, RMA, right? Refuse medical advice, because they're telling you should go get checked out, and then you don't. And that can affect the value of your case sometimes. But again, the most important thing is more important than your case is receiving the proper medical attention. I would say probably the most common where people refuse medical advice is typically where one person's driving and there's other family members in the car, wife, kids, and they have serious injuries, blood, whatever, and they get taken by ambulance. And there's always somebody, it's typically the husband, who just refuses to go by ambulance, even though they're told they should, because they want to be with their spouse or their kids, obviously. And they'll hitch a ride with someone to the hospital that their kid went to, even though they're supposed to go to another hospital, because your child or your wife's injuries are more important than your own. And that's completely understandable. And that's why I say you got to do what you got to do is more important. We'll worry about your case later. You have to take care of yourself and take care of your family. That's more important. So in terms of when should you first go, you have to listen to your body and you have to make the best decisions for you.
What types of injuries do you see most often that show up hours or even days later?
Well, obviously soft tissue injuries are probably the most common, back, neck, muscles. They don't show up on injuries or x-rays, but they do tend to, they tend to show up a few days later, like we talked about, because once the adrenaline wears off, that's probably the most common, obviously. But in terms of like serious injuries, muscle tears, tendon tears, those are something that show up on MRIs, few days or a few weeks later. Typical. Your back hurt, your shoulder hurts, or maybe your knee hurts, your legs hurt, and after a few weeks, it just doesn't go away, and you keep going, and that's when a doctor will typically order some type of MRI, and then a lot of times that's when some type of tear shows up. That's very common. I'd say shoulder tears, meniscus tears in the knee, for like T-bone accidents. Those are pretty common, and those don't show up right away. Now, sometimes they do show up right away because you're taken by ambulance and something's wrong, and the emergency room diagnoses those. But in terms of, I think your question was if it shows up later, those are typically how they come up.
Sometimes accidents victims might worry about overreacting. We've talked about it before. I'm fine, it's just I'm tough, like whatever, I can get past this. How do you explain the difference between being cautious after a crash and maybe perhaps overreacting?
Well, number one is especially if you have health insurance, you pay for it, so you might as well use it.
That's a good point.
I mean, you're paying for it, so don't be afraid of wasting anybody's time. You pay for this every month. You use it. But more importantly, it's about getting healthy and being right. You have to listen to your doctor's advice, and sometimes you do have to push back on doctors, but also know where you're at too. An emergency room doctor's job is different than your primary care physician's job, which is different than your specialist job. Your emergency room doctors, their job is to plug holes, make sure you get better, so that way you can leave and then go to another doctor to get you fixed up better, right? I mean, the emergency room doctor is not going to perform surgery and then do rehab with you and physical therapy. That's not their job. Their job is to save your life, get you moving, and move you on. And there's nothing wrong with that. And then you go to your physical or your primary care doctor, and now their job is kind of like to manage everything big picture. Then you go to your specialist. What their job is to fix the specific part of your body, and they're the ones who will walk you through your physical therapy and make sure you're progressing as normal as compared to other people. So who you're treating with, understand who you're with, what their job is, and what their duties are to you is very important.
When someone wants to, get checked out, maybe the day or two after, is it better to go to urgent care? Is it better to try to go to your primary care or emergency room, chiropractor? Like, is there any specific thing that you find is a better move for people?
Well, again, if you have health insurance, use it, right?
Right.
And especially if you have a relationship with your primary care, that's important. But it does depend. I mean, urgent care is typically a quicker wait than the emergency room. If you go to the emergency room a day later, I mean, I don't even know if they'll even see you.
That's a good point.
This is an emergency right here in town and right here, right? I mean, what do you have? You have an emergency room, and right across the street, you have the urgent care.
Yep.
And the emergency room will tell you urgent care is over there.
Mm.
And of course, it does depend too on and I think we all know this. You call your primary care physician, and they can't get you in for 3 weeks, but
Yeah.
somebody else's primary care physician, they can get them in the next day. It all depends. So again, it's you have to listen to your body and what you can do and what you can decide. And if you don't have insurance or you don't have medical insurance, we have a list of doctors that we can refer you to. Who operate on a lean basis, and you no money up front, you pay at the end of your case on the recovery. So every case is different. Every case is individually tailored to the injuries and the pain that the client is suffering.
What do you think people need to understand about how, doctor's visits, symptoms, notes, treatment plans end up affecting the negotiations of their case?
Remember, everything you do, if it gets into litigation, it gets to a trial, everything you do is used against you in the sense that the defense is going to take things and twist your words around and everything you say and your actions and just, try to make you look like you're either over exaggerating your injuries or making it sound worse because they want to pay you less. Mm-hmm. So when you sit here and you give testimony and a deposition, and then you go to a trial and you testify in front of a panel of 12 jurors, and you say, 5 weeks in, that was the most pain I've ever felt, and you start testifying that, and then the defense pulls up, well, if you were in the most amount of pain, why did you go to work? Why did you miss 5 doctor's appointments? Why did you miss if this is, and that's how those kind of things come out against you. And I mean, it's not the end of the world. I mean, it is something that we as your attorney have to be prepared for and try to fix. But missing doctor's appointments can be very, can be, can be an issue. But there's also reasons why those things. We just recently had a client who missed a surgery date. Well, the reason why they missed the surgery date is because the doctor didn't have the proper, didn't have all the medical records from the different emergency room and urgent care. So because he didn't feel safe moving forward, so they just rescheduled it for 2 weeks. That's fine. That's a simple explanation. It's not anything that the client said or did. It's just that's how it happens. But if you're just missing doctor's appointments all the time, or you're not following your physical therapy plan, those are things that can be used against you for sure.
That's interesting. I think it's probably something good for people to know. Like the opposing counsel is going to know if you're going to your appointments, if you're skipping them, if you've ended treatment early, whatever it is. They know all that stuff.
They do. And I've just had I have this conversation with my clients a lot. You have to know your case. You have to know your doctors, and you have to know your appointments, because when it gets to a trial, that attorney will be prepared, and you absolutely cannot have an attorney know your case better than you. Mm-hmm. You have to know the date, why they told you they wanted physical therapy, why you went to physical therapy, why you had this surgery. And, a lot of times just well, I don't know. That's what my doctor told me. That usually doesn't cut it. It's, you have to know. I was having pain in my back or my neck. They told me there was, you don't have to know, obviously, the medical terms. They just told me I had a 8-millimeter bulge in my neck, and I know I had pain in my neck, and that's why they recommended the surgery. They told me the risks. They told me the rewards, and that was the decision I made. But you have to know your case. You absolutely have to know your case better than the opposing counsel or the defense, for sure.
Mm-hmm. Yeah, good advice there for sure. Are there any specific treatment patterns that usually make an injury claim easier to resolve, or perhaps some that might create more challenges in a case?
Yeah, consistency. Listening to your doctors, listening to your medical advice, and a lot of times, and when I say listening, it doesn't mean you have to do everything the doctor tells you, but sometimes they're going to make you make a decision. And like I said, you weigh your risks, you weigh your rewards. Sometimes a doctor may say, "Look, we can do a surgery, but here's the risks. But it may make the injury worse." So you make your medical decisions. But consistency in your treatment and your medical appointments, that's the most important thing.
Mm-hmm. Are there any considerations if someone has, is juggling work, kids, transportation issues, all that stuff to try to get to these doctor's appointments? If it's really difficult for them, will any consideration be played for that, or will the defense just jump all over that?
They'll jump all over it, and again, it's our job to mitigate it. But again, it goes to severity, right? I mean, if you're paralyzed,
yeah,
you're going to make your doctor appointment, right? You're not going to go to work.
A little different, yeah.
Right. I mean, if your meniscus is torn, your ACL is torn, you're going to find the time to get that fixed because you can't walk. Same thing with your neck. If there's a bulging disc and you can't move, you can't move your neck at all, but you're still going to work, you're going to find the time to get that fixed.
Right. Good point.
Yeah. So, of course, yeah. And a lot of times, yeah, juggling work and juggling kids and school and everything else, it's a grind. But if the injury is severe enough, you're going to find the time to get it fixed. Especially if it requires surgery or even arthroscopic surgery. Because as you know, too, the longer a tear sits, either the more difficult a surgery takes, or they can't do surgery anymore either. So
right.
It just
because your body's going to try to heal itself, and maybe it's not healing itself right.
Especially like your muscle, your arms, your muscles. There's a point like with your torn bicep or tricep. If you don't get it worked on within days, I've been told days, it'll retract itself, and because it'll try to fix itself, and now you might be out of luck, right?
Mm-hmm.
Mm-hmm.
Our last episode, we talked about adjusters, and I'm curious to know if you are hurting, maybe you're not, obviously you're not in the hospital, but if you're hurting and an adjuster calls and you're like, yeah, I'm pretty sore, I've got a lot of pain going on, I've got to, I'm going to see a doctor soon. Will they still try to get you to sign something at that point?
It depends, and every insurance company is different. Every adjuster is different. The severity depends. It depends on the severity. But remember, the insurance adjusters we talked about. Once you sign a release, and once you sign off on, if you settle for $1,500, case is over. You can't go back and sue, even if you find there's something else. But there's also a presumption if you're in the hospital and under medication that your signature wasn't necessarily made under duress as well. So they're not really going to try and get you to sign while you're still in the hospital and under the influence of drugs or prescribed drugs or anything, or not making a decision, because that can come back and bite and hurt them.
They're not going to visit you in the hospital with flowers and a contract to sign.
Well, they shouldn't, but they should not. But it is well known that there are companies and government agencies that do that. Absolutely, they will go to because they're self-insured. So they don't necessarily follow the rules of a lot, like an insurance company like State Farm or somebody. That they are when they're self-insured, especially government entities. And because the government entities are given a lot of qualified immunity, but they certainly will. They'll go to the emergency room, and it's not uncommon. But your average insurance company will not, because for those reasons that we talked about earlier.
Do you ever run into situations where sometimes like people have pain, but the doctors aren't really able to figure out what's wrong? Because I've had that before, where you go see a doctor and like, yeah, I'm not sure, it looks pretty good, I don't know where that's coming from, because that's got to be tough, because then you're in that situation you're not getting evidence that you desperately need for your case.
Well, and that's why, depending on where you're at, the emergency room doctor is not going to take care of you for that, and maybe in your primary care isn't going to, but they'll have to find some specialist. It could be nerve damage, so they'll have to send you to like some type of nerve damage pain management doctor, then they do nerve tests all the time, which again, MRIs, those are more important than x-rays. Can they focus on a certain part of the body? And that's where the physical therapy comes into play. You start doing physical therapy, and it's like, that's why they ask you, does this hurt? Does that hurt? When you do this, and then they try to narrow down where it's at. But yeah, absolutely. Nerve pain is a big component of what big part of injuries, particularly after car crashes.
Yeah, that is definitely something that is tough to diagnose too, for sure.
Certainly.
All right, well, that's it for today's episode of The Moody Lawyer. If you've been injured in an accident and aren't sure how to handle your medical treatment or what it means for your claim, Josh and his team can help you understand your options and protect your case from the start. Visit moodylawyer.com to schedule a free case evaluation, and don't forget to subscribe to our channel so you don't miss the next episodes. We got lots of great stuff coming your way. Josh, it's always great chatting with you. Thanks so much.
Thank you.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.